Okay, you all ready? Okay, so we're going to talk about Bitewings, and we will get into the parallel technique, but I think I want to just circle back to the bisecting technique just for a little bit, because now you have experience with what the bisector is. Okay, so what is the bisector?
Bisector is the
it's the angle that bisects the angle of the film and the angle of the tube.
Perfect. It is right between those two, right? And it equally divides those two angles. So that is the bisector. So you've been working with that on the anterior so far. You've been working with that on the lower anteriors. And now you are, if you haven't tried it already, you're doing the posteriors. You know, some of you are already doing the posteriors. So I want to circle back to the Bitewing when it comes to your vertical angle. So I'm going to take this and place it in the mouth, and then, you know, if this patient was to close, and by the way, I typically do this when it comes to a real patient. I don't leave that nice and straight. I tend to just roll it over my finger, especially those corners, because those corners will sometimes get your patient a little bit. And as long as you don't overly bend it and crease your film, you'll be okay. If you crease your film, you'll break something inside of here that's called the emulsion. And the emulsion, if you haven't read that in your chapter already, it's the gelatin coating that covers this thing. And if you crease it, it turns it black, and then it'll cover up something that we need to see. But I do it just enough to sort of soften that film up, round those corners out, and I can ask this patient to close on down. But you can almost tell, if I was to have this patient close down, that the upper palate would do this to the film. This upper palate would just take that film and make it bend that way. Does that make sense?
Yes.
Okay. So when you take this and you place it in the patient's mouth and they're biting on it, it is really no longer straight. So before I was having you come in at 0 degrees, no negative, no positive, just nice and straight. Now, when it comes to your patients, I'm going to have you subtly change this depending on what you guys see. So typically these teeth are going fairly straight, you know, if you're considering the uppers and the lowers, that's going at that direction. Your film is now coming in at this direction. So between there, you are kind of like at this angle. So this would be your bisector when it comes to Bitewings. So typically, and if you look in your book, it talks about how Bitewings could be at a positive 5 degrees. And if you saw that in your book and you wondered why is that positive, if Mr. Silva said that we're coming in at 0 degrees, that is now the reason. But 0 degrees when it comes to Dexter's, it wasn't going to make much of a difference. But I just thought it was an easy way to just kind of introduce you to Bitewings so that you didn't have to think about your vertical too much. But now that you know what the bisector is, sometimes, depending on the bite of this patient, you can come in at about a 5 degree angle. Does that make sense?
Yes.
Okay. Does it make sense? And it's okay if it doesn't. No, it doesn't. And it's okay. Go ahead.
For the top?
No, well, it is both, because remember, Bitewing is incorporating the top and the bottom. The top and the bottom, all in one picture.
How do you do the top? Like if you
Like
wanted
the
to do
periapicals?
Yeah.
Yeah, I don't have the stuff with me right here, but I have the video on it in your canvas shell. Yeah, so it's already in there. But I can show you back here when we get back in there. I'll show you how to do that. So I'll revisit that with you when we do that. Okay. But I just want to talk about it. So let me just do this. So if I pull this thing out, if I pull that tooth out, and that tooth is at this angle. So I'm going to go back to bisecting for the anterior just to answer your question. And and I have the film behind it, and let's just say that it is at that angle. So this is going straight up and down, and this is going at this angle. Okay, so we have two different angles, right? There is the angle of the film, angle of the long axis of the tooth, and the bisector is somewhere between those two, right? So this is what is the angle that you come in at with here.
Okay.
Okay, so we've gone over this one already, so that makes sense, right? Well, all I'm saying now is the same thing with the Bitewing. It might turn slightly this way because of the palate, the patient's palate of right here would probably turn that film a little bit this way. So for Bitewings, you may consider now not coming in straight, but putting a little bit of vertical angle in there, because sometimes what happens is if you don't do that and the top is the only part that is, like, the bottom might be nice and straight, but the top might be like this. Your top teeth might be stretched out. The top Bitewings might look a little bit stretched out because it's coming at a different angle. Okay, does that make sense? Okay.
Does that also affect the dexters that we have? Like, do some of the dexters sometimes make the film
A little bit.
a little bit?
Yeah, yeah.
We just
So,
mostly have to worry about patient-wise because they're more likely to make the film bend.
because they have the gingiva in the patient's mouth, they have tissue in there. Some patients have a very low palate, making this thing bend even more. Dexters don't have any of that in there, but even the bone that they have, you'll start to pay attention now that I've talked about this. When you place it in the patient's mouth, you might see the Bitewing bend slightly like this, and you have to compensate for that and turn your PID slightly. Okay, so are we good on bisecting?
Yeah.
Okay, so let's get to the other part, and I don't know if you guys had me for digital when I talked about this, but do y'all remember what this is called?
The, it had an A in it. Angle, no.
So this whole set is called the XCP, Extension Cone Parallel, Extension Cone Parallel. But this part is called, and you were pretty close because it does start with an A,
I knew it.
aiming ring, aiming ring. So, you know, when I'm asking for something or when you ask for something, and that's why we kind of go over the names of these things, because you can't, if you forgot something in the room, you can't go, hey, can you give me that you know, that thingy? That thingy with the round thing, and then it's kind of white with, it's got the little tiny, you know, and you're trying to do this crazy description of it, and they're like, can you just tell me the name, you know, and they'll know what it is. So this is the aiming ring, because we're aiming at it, okay. This is...
Metal bar thingy.
I'm going to throw it at you. This is the indicating rod. The indicating rod. Okay, indicating rod. And? Say it again? It is the Bitewing bite block. Bite block. Okay, so we have those in there. So this is the same process of putting this thing together as it was for digital. So if we have, and we're doing Bitewings, Bitewings are color coded. Red, red, red. And you'll notice that the red on here is on the long portion of this thing. Now, just to remind you that some dental offices, they don't have this one where it has the 3 in it. They have 3 separate rings. And you have to pick the red ring for the, you know, Bitewings, this one for the anteriors, that one for the posteriors. But this encompasses the whole thing. So, so red to red, and you want to make sure that these forks are going sort of in the direction of the aiming ring, okay? And the only thing you have to do from this point forward is to place the bite block on here. Now, when I take and I place this thing on here, this portion, the wing portion, is off to the end. It's off to the end. And if I turn it this way, you'll see that there is a mark going right through here. Okay, so it is just another indicator that it should be on this side. And when you take your film and you place it in the holder, it's better not to try to slide it through, because if you try to put it in there, you could possibly bend it and break the emulsion, okay, and causing issues, and then you'll have to retake that at some point if it interferes with the teeth that we're trying to take. So what I like to do is to place one side in, fold it slightly, and get the other side in. And then when you complete that, always turn around and verify, is your film centered in the aiming ring? Is it centered in the aiming ring? Okay.
It looks like it.
And if it is, we know that you're not going to get what error?
Cut.
Cone cut, yeah. So you've just eliminated that whole idea about getting a cone cut. Now, can you get a cone cut with this? Yeah, it's possible if you do this the wrong way, or we didn't center the film within the PID or within the aiming ring. Okay. Don't worry about that film that it's curved. You know, there's really nothing we can do about that at this point. You can try to push it in just a little bit, but you might risk creasing the film a little bit. We okay so far? Mm-hmm. Okay. So this is no different as far as what teeth we're trying to get in the patient's mouth when we're doing this. So if we're taking a premolar picture, we are trying to include what tooth?
The canine.
The canine. Identify your canine. Canine's right here. And we're going to place this in the patient's mouth. Now, in the bisecting technique, the film was right up against those teeth. It was very close. In the parallel technique, we don't do that. Excuse me. The film is towards the center of the mouth, in the highest point of the palate, okay? And we can rotate it, you know, we can rotate it to where we are going at the angle of the premolars, but it has to be somewhere, excuse me, towards the center of the mouth. Go ahead.
Where should we move the tongue of the patient if we put it in the center?
We gotta really push that over a little bit. Good point. And that's what I mean about this, is because we're working with the models that don't have tongues, there's no lips, there's no saliva, there's no gag reflex, you know, there's none of those things. Elise Dexter over there has a tongue that you guys can contend with a little bit. But the real work is when you guys start working with each other and you're like, okay, now I gotta retract the lip and ask the patient to move their tongue over. So sometimes we physically take that tongue and we push it over, you know, and we'll do that. And it's the strangest thing sometimes, because some of your patients are tongue thrusters. They'll take their tongue and they'll fight with you on this thing. You're trying to push it in and they're literally trying to push this thing out, you know, and the tongue is the strongest muscle in the body, so it's force. They're really trying to fight with you a little bit on this one. Some of your patients, not all of them. Okay, so coming from the side, this is typically how you want to do it. I've seen, I'm just going to kind of do this. I've seen assistants where they come and they will place this from the very front of the patient's mouth, and they'll try to set it this way. The problem with that is you get a very different angle to understand what your film is covering as far as teeth goes. Right now, from this angle, it looks like I'm covering all the way up to the central incisors. If I come around this side, it's only covering up the premolar. You know, so you really do want to look on the side that you're actually working on. And for starters, as you guys are just doing this, I would actually look through the ring and ask yourself, is the film behind my canine? Is the film behind my canine? And if it's not, you would take it and try to push it forward. Now, if your patient has like bony structure towards the front, don't force it, because that little corner is going to dig into that patient's palate a little bit. So what I would do is make sure that you just rotate it slightly to the angle of the premolars. The horizontal angle of those premolars, you want to rotate it in that direction. Close down all the way. And the great thing about this technique is, and I'm going to take this and turn it around. The great thing about this technique is that for the most part, if you place it in the patient's mouth the right way, it'll take care of your vertical angle. It'll cover the film or sensor. The only thing you guys have to work on is your horizontal angle. Because if the horizontal angle is off, what is the error?
You can get a cone cut on the film. You won't cover the film.
It's possible, but you can still get a bad horizontal angle and you can still cover the film.
Oh, is that going to distort the image a little bit?
It'll distort it in a certain way. There's a lot of ways we could distort it, but more specifically, when you have a bad horizontal angle, there's something you can't see. Can you see through my fingertips?
Oh,
There's gonna leave a gap. They won't leave a gap. Yeah, it will overlap.
And so what is the error called?
Interproximal.
Well, interproximal is what we're trying to see.
what's the name of the error though?
What's the name of the error? Going once, going twice? Overlapping. Overlapping.
Didn't you just say overlapping? I did say overlapping, but I was like, is
Oh, you did?
I did, but I didn't know if that was like the right thing.
Yeah, it was. Sorry about that.
We got it right. What the heck?
So in this way, you can do this two different ways. If you're looking through the interproximal spaces because that was working better for you, you just want to make sure that you're pointing this ring almost like you're pointing the PID. That way you're getting through the interproximal spaces, if that worked for you. For some of you, it worked better if you looked from the front. And guess what? You've got something to work with. So remember when we did these little sticks, and we were saying the angle of those premolars, it's coming in at this angle, wasn't coming in at this angle, it's coming in at this angle. This happens to be parallel almost with this one. I should probably turn this in slightly just a little bit. This is parallel with this. Does that make sense?
Oh, it does the work for us then.
What's that?
I said it does the work for us, like with the.
Yeah, I mean, as far as having something visual to look at, yeah, it does it. But you could get the only thing you have to fight for on this thing is your horizontal angle, because you could make a mistake and do this. If you place this the wrong way horizontally, you can still get overlapping, you know. So you have to make sure that the angle of your premolars and the angle of your amine ring, that they're coming in parallel with the teeth that you're trying to work on. Does that make sense? Mm-hmm. Okay. Any questions on that? Okay. Last thing is, when you complete that whole process, you're going to take this and now initially placing this in the patient's mouth, I make sure that the ring is far back. Give yourself some room. If you attempt to do this and you place it in the patient's mouth like this, that ring is going to hit the patient in the cheek, and you won't be able to get this in the patient's mouth, and then, you know, you're going to have issues. So pull this all the way back, place it in the patient's mouth, come in at an angle, come on in, ask that patient to move their tongue on over, look through the ring, make sure you get your canine in that picture, and we'll close on down. And at that point, we're going to take the amine ring, and with your thumb and one of your fingers, you're going to squeeze and push that all the way in, okay? Close, but not touching the patient's face. But don't do this, because if you do this, it'll rotate and it'll torque in that patient's mouth, and it'll scrape that palate as it goes through, you know. So this is the safer way to go when it comes to your patient and bringing that all the way in. And the last thing that you have to do is just take your PID and make sure that you are close to the amine ring and that you are equal distance all the way around. You're not coming in at this angle, I'm exaggerating, this angle or this angle. but you are equal distance all the way around. Because even if you're slightly off just a little bit, there goes that overlapping again, okay? So I want to show that last part to the camera just a little bit. Aiming ring. Close, but not touching, equal distance all the way around. We don't want to come in at any other angle than the angle that it's asking us to come in at. Okay. Any other questions? Pretty simple, right, for those? Okay.
So, going back to the colors, what is the yellow and the blue for?
So the blue is typically for the anteriors. Blue is typically for the anteriors, and yellow is typically for the posteriors.
Okay.
But you could use a yellow for the anterior. And we'll talk about that when I start introducing some of the other indicating rods that we have on there.
And we always have to use the Bitewing block for each area?
No, another good question. We have two other bite blocks. We have a bite block that is blue, and we have a bite block that is yellow. So the blue one is vertical, and the yellow one is horizontal. Vertical because they're the anteriors. Horizontal because they're the posteriors. Okay, good question. Okay, ready for some x-rays?